Alright, today we're going to be looking at the mechanics of a backflip or back tuck. Here is an example of a basic backflip. The four different phases we're going to be looking at are the preload phase, the explosion phase, the mid-flight phase, and finally the landing phase. During each phase, we will examine which joint is moving, the type of movement occurring at the joint, and the muscles involved and whether they are working eccentrically, concentrically, or isometrically. Now we're going to take a look at the backflip from some different points of view. The entire backflip takes place in the sagittal plane with a medial lateral axis at the hip, knee, and ankle. During the preload phase, the acetabular-femoral joint moves the lower body into flexion. This is caused by an eccentric contraction of the bicep femoris and the gluteus maximus. We also see an anterior pelvic tilt occurring at the hip joint caused by the iliopsoas. At the knee, the tibial-femoral joint is also moving the lower body into a flexed position. This is caused by the eccentric muscles of the quadricep, the rectus femoris, and vastus muscles. At the ankle, the talocrural joint moves into dorsiflexion at the ankle during the preload phase. This is caused by the eccentric contraction of the gastrocnemius and the peroneus longus. During phase 2, the acetabular-femoral joint quickly accelerates from the flexed position into full extension. This is caused by the gluteus maximus and the hamstring muscles working concentrically. At the tibial-femoral joint, the body moves into extension. The quadricep muscles help to propel the body, combining the rectus femoris and the vastus lateralis, medialis, and intermedius, contracting concentrically. At the talocrural joint, we move into plantar flexion with the agonist muscles being the sartorius and the gastrocnemius. These muscles are contracting concentrically. During the mid-flight phase at the acetabular-femoral joint, we have the hip flexor muscles, the iliacus and psoas major, working concentrically. At the talofemoral joint, we have the hamstrings working concentrically, bringing the knee into flexion. At the talocrural joint, we have plantar flexion, which occurs isometrically in the gastrocnemius. At the final phase, the landing phase, at the acetabular-femoral joint, we have flexion, which occurs eccentrically by the antagonist muscles, the hamstrings, and the glutes. At the tibial-femoral joint, we also have flexion, which occurs eccentrically by the antagonist quad muscles. At the talocrural joint, we have dorsiflexion, which occurs eccentrically through the gastrocnemius. So all put together, the backflip should look something like this. Believe it or not, a lot of you are capable of performing a backflip. Two of the most important things for success in attempting a backflip are a strong core and not second-guessing yourself. Good luck! However, there are some injuries that can occur during a backflip. The backflip puts a lot of pressure on your acetabular-femoral, your tibial-femoral, and your talocrural joint. So before performing the backflip, make sure you are properly stretched out. One of the most common injuries occurs at the talocrural joint during the landing phase. Excessive dorsiflexion can occur and cause injury to the bones, ligaments, and muscles. Thank you for watching my video on the mechanics of a backflip. I hope you learned a lot about the different joints, muscles, and movements that occur during a backflip.